Hello, everyone. Thank you so much for being here with us with this workshop through Frankly Speaking about cancer, non-melanoma skin cancers with Dr. Lydia Kim. My name is Rebecca. I'm the program manager here. I just wanted to do the introductions. So Dr. Lydia Kim, did you want to introduce yourself?
Hello, everyone. My name is Lydia Kim. I am a board certified dermatologist. I work at a practice Clear Dermatology, both in Torrance and Manhattan Beach. And thank you so much for having me here today. And then I have no financial relationships or affiliations to disclose.
Thank you so much, Dr. Kim, for donating your time and expertise with us today. So I just want to share about cancer support community for those who are unfamiliar. We are a relentless ally for anyone who is striving to manage the realities of this disruptive disease. No one can or should face cancer alone. While we have witnessed many advances in treating cancer, nothing takes the place of the power, inspiration, companionship, and connection that comes from community, because community is stronger than cancer. And we are a national organization. Let's go to the agenda.
Okay. So we are going to be empowering through knowledge. So we're going to go through some important terms and then review kind of non-melanoma skin cancers, and then review some of the treatment options that are available. Then we're going to review how to kind of prepare so you can be strengthened by actions that you can take, and then kind of the community resources that are available.
So these slides that Dr. Kim will be showing were medically reviewed and updated by Dr. Vishal A. Patel, MD, in December of 2022. So just to talk a little bit about us at Cancer Support Community South Bay, our mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. So without further ado, I'd like to welcome Dr. Kim. Thank you so much.
All right. Well, thank you again to Rebecca and for this organization for having me come speak with you today. We're going to review some important terms, review kind of the main key points about non-melanoma skin cancers, and talk about some treatment options available for treating non-melanoma skin cancer. So some kind of basic terms. Dermatologist is usually a physician. There are some kind of mid-level providers also who have specialized and studied skin in depth. So skin involves hair, your regular skin, nails. And then a medical oncologist is usually a physician who has more specialized training to treat treat cancers in general, of which skin cancers make up a subset. A skin exam is what you do usually at the dermatologist's office, where kind of your dermatologist looks over your skin, kind of checks everywhere to look for and identify any spots of concern, anything that's worrisome that needs potentially a skin biopsy, which is our last term. A skin biopsy is where we kind of remove a portion of the skin, either to kind of test it because we're worried about something, or to help us kind of identify more information about what's going on in your skin to help kind of steer the treatment. So what are non-melanoma skin cancers? So skin cancers, there's kind of two broad categories. What we're going to cover today encompasses most of the skin cancers that are kind of present. So non-melanoma skin cancers, there are three major types. The first is basal cell carcinoma. The second is squamous cell carcinoma, and the third is Merkel cell carcinoma. And we'll review these a little bit in more detail in a bit. Kind of the next major category of skin cancers are the melanoma skin cancers. So today we're going to focus on the non-melanoma skin cancers, which usually arise within the topmost layers of the skin. And so there are various risk factors that you have to keep in mind when we discuss skin cancer, consider skin cancer. People of all skin tones, not just the fair skin tones, are at risk of developing skin cancer. it is more common to see skin cancer in people who have fairer or lighter skin tones. But the kind of 5 bullet points below review kind of the more risks that increase your likelihood of having skin cancer, which include exposure to excessive sunlight or UV radiation, personal history or family history of skin cancer, history of radiation, having a weakened immune system, whether it be you having your having a condition that decreases your immune system, or perhaps taking medications that can weaken your immune system. And then another less common but possible risk is arsenic exposure. So I think initially we're going to talk about more early stage cancers, but there are early stage and then advanced non-melanoma skin cancers. And so, you know, it's hard to know how familiar everyone is about skin cancer. These are kind of common questions that people can have when it comes to talking about skin cancers. So, you know, what is cancer staging? Why is it necessary? What diagnostic tests did you perform to figure out the stage of skin cancer? And then does this stage of cancer impact treatment options? Most of the non-melanoma skin cancers that I encounter, and which is more kind of widely present, is really early, kind of almost stage 0 or stage 1 skin cancer. But depending on what type of cancer you have, it can kind of range. Does anyone have similar questions to this or familiar with raise of hands? Does anyone have any concerns about cancer staging? Mm-hmm. Oh, yes. Okay. All right. For those of you who couldn't hear, right? There was someone in the audience here asking about a specific cancer treatment, so we can touch on that in a bit. All right, so I'm going to talk about basal cell carcinoma, which is going to be the most common skin cancer and kind of the most common cancer in all kind of reported cancers in the United States and probably worldwide. It's a very slow growing skin cancer. It rarely spreads or reaches advanced stage, and it's often found early and it's very curable. So, you know, there's a diagram here of kind of the top of all the layers of the skin. If you look kind of at that healthy epidermis in the top corner, there's the epidermis, there's the dermis and the fat layer, but within just that topmost layer of the skin, the epidermis, the base of that layer is called the basal layer. And so basal cell carcinoma arises from the basal layer of skin. So that's how it gets its name. Squamous cell carcinoma, it counts for about 40% of skin cancers, so it's not as common. It arises within the squamous layers of cells, which is above the basal layer. And this type of skin cancer can be a bit more aggressive. There are squamous cell carcinomas that arise both from the skin, but you can get squamous cell carcinomas of other origins as well. So like certain types of lung cancer can be squamous cell carcinoma, but they're considered different categories of cancer. So they're not really comparable. But yeah, squamous cell carcinoma also arises more from sun exposure, can be a bit more aggressive, and has a higher risk of spreading, particularly if you are immunosuppressed in some way. And then the last type of skin cancer we'll talk about is Merkel cell carcinoma. This is a much less common type of skin cancer. I think there's only been like 2,000, I can't remember if it's 2,000 or 4,000 reported cases a year of this type of skin cancer. It's a rare and fast-growing type of skin cancer. It's much more common in older patients. So if you're over the age of 70, and it has a preference for predominance in male patients. So if you're a male, you are 2 times more likely to develop this than a female. It's seldom found early because it tends to grow quickly and spread quickly. So when it's discovered at a later stage, which kind of portends a poor prognosis. So Merkel cell, the name arises from the type of cell that it originates from. So the Merkel cell is a type of nerve cell that's kind of interspersed within your skin. There was a famous singer who recently passed away that gave this a little bit more made people more aware of this skin cancer. I can't remember. All right, so advanced non-melanoma skin cancers, that's basically when your skin cancer has progressed to kind of either a larger size or a deeper stage. And so for basal cell carcinomas, this is, again, very uncommon, more likely if you have some sort of underlying genetic condition or you're severely immunosuppressed. So you're considered large stage if you have a very large tumor that's spread to other places like your bone, your muscles, or your tendons. Squamous cell carcinoma, the more common place for it to initially spread to is your lymph node, but once it gets into your lymph node, then it's a bit more challenging to treat. And from your lymph nodes, it could spread kind of to other organs as well. Merkel cell carcinoma, again, it's found usually at a later stage, and often when it's found, it's at a stage where it's harder to treat and likely to be uncurable because it's very aggressive and grows quickly. So the signs and symptoms that I would like to share with everyone to be aware of non-melanoma skin cancers that kind of clues you in that you should get something checked is if you have an open sore that's not healing. These spots usually appear as little red or kind of raised bumps. Some of them, like squamous cell carcinomas, can have more of like a rough, warty texture. And then, anytime you have an unusual lump on the skin that's been there for more than a month, that's usually when I recommend trying to go see your dermatologist. There are several myths I wanted to debunk. Sun exposure is the only cause of skin cancer. We reviewed, there are other types of exposures such as radiation, arsenic, certain medications that can kind of increase your risk of skin cancer. Sunscreen should not only be applied during the summer because there's sun, especially in Southern California, all year long. So you want to wear sunscreen, especially if you're going to be outside. I always recommend every day. And then people with darker skin tones don't get skin cancer. This is a myth. People with darker skin, it may be less obvious when you have a new spot or kind of a concerning spot, and it may not be caught early. And so oftentimes people with darker skin, unfortunately, there's a bump that has been kind of left alone and untreated for longer. So it's often found or discovered at a later stage or kind of when the spot has grown to a significant size. So kind of expounding on that, basal cells, instead of being kind of pink shiny bumps, can appear as a dark colored bump on skin, people with skin of color. These can be sores that scab and bleed frequently and don't really go away. Those kind of features can also be seen with squamous cell carcinoma, but in skin of color, it could be more like a firm red bump or a scaly patch or an open sore that doesn't go away. And then Merkel cell, usually a lump or a bump in the skin that is red or violet in color. And there are some kind of educational handouts that are available through the cancer support community with more information about skin of color and skin cancer. All right, so early stage treatment options for non-melanoma skin cancer. There's several different options. There's topical treatments, local therapies, radiation therapy, and surgery. So topical medications, there are medications like 5-fluorouracil or Aldera or imiquimod that you could directly apply to the skin. You usually need to treat it for anywhere from 3 to 6 weeks. And then it kind of damages and removes the rest of the skin cancer that may have arose in your skin. Local therapies, I am not sure what that refers to, so we'll skip that for now. Radiation therapy, this is becoming more prevalent. I think there still needs to be a lot more research that needs to go into this, but there's localized radiation therapy to treat more late stage skin cancers, like squamous cell carcinoma is usually where I've seen it. But there's kind of lower dosage radiation therapy that's coming out, available for treatment of basal cell carcinoma and squamous cell carcinoma. Oh, sorry, thank you. Local therapies refers to treatments like photodynamic therapy, what you were referring to, where you apply medication and kind of treat the entire field area. So you apply the medicine and then you expose to light and then it kind of treats it. Local therapies also refers to cryotherapy or freezing treatments. Thank you. And then the last option for more early stage skin cancers is surgery. So these are procedural treatments. So you have surgery to kind of cut things out, put in stitches. Mohs surgery is a specialized type of skin cancer surgery that kind of you remove skin cancer. The doctor will review and kind of process the tissue while you're waiting, and they keep on going back to take more. And then if they get it all, then you're considered cured. But it's nice because you know at the end of the day that they got all the skin cancer out. And then curettage and electrodesiccation, or C&E, that's also kind of a localized destructive method where we kind of burn and scrape the skin tissue to remove any of the tumor skin cancer that's still remaining. So for advanced stage treatment options, surgery is an option similar to the options that I discussed before, but more kind of the more definitive surgery where you cut into the skin and put in stitches. There's radiation therapy where you use kind of radiation to locally and targetedly treat wherever you have the skin cancer. Immunotherapy is a newer kind of modality of treatments that has kind of come into play probably in the last 10 to 20 years. But it's medications that kind of help target your own body's immune system to target a skin cancer. So we're seeing these in treatment more for squamous cell carcinoma and Merkel cell carcinoma now. And then chemotherapy, it basically just kind of blasts any cells that are rapidly dividing, which is very typical of skin cancer or cancer in general, to kind of get rid of this cancer. And then targeted therapy, I think that would be more kind of like the localized treatment that we had discussed with like Efudex and imiquimod. There's a couple new medications like vismodegib that can target treatments. Okay, is this still my stuff? String. Okay. So you always want to be your own advocate. So I'm going to review a couple things that you can do to kind of be your best advocate. So when you are preparing for your appointment, it's helpful for you to prepare. So, make sure that you talk to your healthcare team about how you're feeling. Don't be afraid to ask questions. I know it may be, you may feel rushed when you go to your appointments, but that time is for you to really get your questions answered. So make use of the knowledge of your physicians and the providers that you're seeing. And then, so it's helpful if you take people like a loved one or a family member or someone you trust with you to your appointments. They can be an extra set of eyes. They can help you remember the things that you had mentioned, wanted to discuss at your appointments. Many of my patients bring in lists of things that they want to talk about so that they don't forget. And then if you're unsatisfied, or if you have a little bit of kind of reservation about what your doctor is recommending, it's never a bad idea to get a second opinion. Some people are worried that your doctor might feel offended, but your health is very important. So, be your best advocate and don't be afraid to kind of stand up for what you want and what you feel like is necessary for you.
On that note, for the second opinion, is the primary physician the one who requests an authorization, or how do you transfer to a next visit to somebody else?
Sure. So the question about was who is able to initiate a second opinion request. It's highly dependent on your insurance. And so if you have an HMO plan where you need a referral from your primary care doctor, then you have to go to back to your primary care doctor and then ask for a second opinion in most cases. Otherwise, if you're at a practice with multiple providers, you could ask the doctor if you can see another provider at that practice, in which case you may not need a new referral for a second opinion. For if you have a PPO insurance, or if you have most Medicare insurances, you can go through your list of different options and select a different provider to see. Does that answer your question? Yeah. And kind of to follow up for caregivers and loved ones, take notes when you're at your appointments. I'm sure that you're with somebody who has many other family members who want to know what was discussed. And so if you take notes, it helps kind of jog your memory when you review the details of the appointment. Emphasize and support your patient's concerns, and then schedule a follow-up visit if you have additional questions that they were not able to address at your appointment. And then for healthcare professionals, listen and observe to kind of include the psychosocial factors that often come with any sort of cancer diagnosis. And then do what you can to build rapport with your patients as well. So here are some worksheets.
Yeah, so I don't use that one. Yeah. It's just a couple of slides on here.
So I'm Nancy Lomibau, Program Director here at Cancer Support Community, and I just want to share a couple of worksheets that we have available. I believe you will be getting some of this information in the email that will follow this presentation. But you'll see there's one that specifically is looking at squamous cell and one for basal cell. And it will outline some of the details about both of these types of cancer, and then the types of questions you might want to be asking about. Is it forwarding from here? There we go, it's transitioning. So these are some of the questions to ask over time. There's a list here, questions regarding prognosis and about treatment. And this is where we're asking about your goals and values. So being able to evaluate what types of things are important to you when you're looking at your family and social relationships, what's going on with those around you, perhaps your work or school, there might be a big impact in that environment. So do you want to continue working? Can you adjust your schedule? Getting community involvement. Are you getting the support that you need from your communities? And are there ways of increasing that? And also exploring what are some other things that are important to you. So this is the piece about considering a second opinion. So I'm going to play this video here.
But I knew that I was getting a second opinion. Yeah. And it's hard, when you're comfortable with the group that you're working with, and so the day that I came into him, I said, he says, I know. And before I even got it out of my mouth, he said, you're going for a second opinion. Be my guest. He says, matter of fact, let me write down some names for you. So, and that's when you have a good group, so when they, when they're adamant and say, oh, you don't need, no, well, then you need to continue. That's even more reason for you to get a second opinion. Yeah. But I knew that I was getting
So one of the other things that we have available are some handouts regarding clinical trials, if you want to find out more about if those are right for you, and a brochure also that explains the guide for patients and caregivers, what to look at, what to consider when you're looking into clinical trials. And again, these will be included in that email you'll receive after this presentation. So it's talking essentially about testing new treatments for cancer, finding new ways to manage symptoms and side effects, advancing understanding of cancer care, and then also some questions there about what you might want to ask your oncology team. So here are some here, what clinical trials are available for my type of cancer? What are the potential benefits of this clinical trial? And what rights do I have as a participant? You might want to start with, am I eligible for a clinical trial? How do I get more information about it? How do I enroll? And then this slide is really addressing some of the things that Cancer Support Community promotes, which is sustained by community within our name, but looking at some universal challenges, emotions, life after diagnosis and survivorship, caregiver concerns and support, and finding support. So these are some of the universal challenges: loss of control, people who are feeling alone, and then that living with uncertainty that can create anxiety in a lot of situations. When you're looking at life after a diagnosis, looking at things like side effects and wanting to make sure you have a survivorship care plan in place, and then really paying attention to your overall emotional wellness. So there is going to be included a brochure called Coping with Side Effects. And this will go over skin changes, looking at any pain or irritation you might be experiencing, fatigue or tiredness, nausea or vomiting, constipation or diarrhea, and mouth sores. We also have a specific brochure looking at managing long-term and late side effects of advanced cancer. And that brochure will be included. It'll talk about more specifically the long-term and late side effects, but also palliative care that's available to help with any type of pain or discomfort you're experiencing. Another big area when we're looking at issues with skin cancer is how it can affect your body image and how you feel about yourself. And so surgery and other treatments for non-melanoma skin cancer, those can lead to physical changes that impact how you think about yourself and how you feel out in the community about yourself. There's also some stigma sometimes that can be connected with skin cancer, and they might feel ashamed about their diagnosis. For instance, many people who may not have worn sunscreen when they were younger or enjoy being in the sun. So, remember, no one deserves cancer, and your diagnosis is not your fault. So here, talking about feelings is important. Our Cancer Experience Registry is a survey that we have available through our headquarters. And what we have found is that respondents are moderately to severely concerned with worrying about the future and what lies ahead. So 53% reported that. 49% are at risk for clinically significant levels of anxiety, 38% at risk for clinical significant levels of depression. So what you can do is you can join a support group. And of course, here at Cancer Support Community, we have many, and we'd encourage you to look into that if that's something you're wanting or needing. We also provide individual counseling, 6 to 10 sessions with an individual therapist. And what else you can do is be open and honest with your family and loved ones. These are some brochures that we have that focus in on the cost of care, which we know for 44% of patients is an area of concern or worry. So it goes into not only money worries, but health insurance as well. Talks about cancer treatment and follow-up appointments that can take place over a few months or even years. The first step in managing the cost of cancer treatment is to ask for help. We also have a full-time navigator that you can meet with if you're wanting to look specifically at your own insurance and your own money concerns. And now this is talking a little bit about when cancer reoccurs or progresses. According to our cancer experience registry, 56 of respondents are moderately to severely concerned with their cancer progressing or coming back. So what you can do is learn the signs, follow your survivorship care plan ahead. And then just want to talk a little bit about scanxiety. That is something that we see very frequently here. A lot of times it's that anxiety that comes up right before you have a recheck or a scan or meet with your oncologist or dermatologist. And it's that feeling of nervousness that comes up. So follow-up and care is very important, maintaining therapy. So maintenance therapy is used to stop or slow the cancer's growth or prevent it from coming back. And the post-treatment survivorship care plans is that follow-up care and usually a written plan in terms of the summary of treatment, any type of scheduled follow-up appointments, additional screenings that you might need, and then referrals to specialists if necessary. In caring for the caregivers, we also have some data here we wanted to share, again, from that cancer experience registry, that 96% provided emotional support, 91% accompanied their loved ones to medical appointments, 79% helped with decision-making, 78% provided transportation, 78% coordinated medical care, and 69% helped manage finances. So we want to recognize that it's not just the cancer patient themselves that is experiencing maybe some overwhelm or needing some emotional support, but the caregiver as well. So again, we have another brochure, and this one's called Caring for a Loved One, and it is focused on support for caregivers. Here at Cancer Support Community, we have two, we call them family partner caregiver support groups, and those are weekly support groups available. So it's really important to take care of yourself, to find that support, looking and asking for help. And then more specifically, taking care of you involves preventing burnout, setting limits or boundaries, pacing yourself as you're going through appointments, and supporting the person around you. Trying to control stress. And for that, we have we have quite a few yoga, mindfulness classes, Tai Chi, Reiki, and other exercise programs to help with that. Make sure that your needs are set as a priority and be direct. Delegate tasks to others. Make sure that you're keeping those tasks realistic and retain flexibility. So finding support, I mentioned we have caregiver support groups here. We provide the individual counseling, one-on-one. Connecting with your religious leaders and communities, that's something that we encourage and support. And sometimes people are in a unique situation where they might be caring for someone from a distance. So understanding the situation, creating a list of important contacts for emergencies, trying not to rush with decision making, listen and seek help when you need it. And this is just discussing our network partnership here at Cancer Support Community South Bay. We have many resources offered through our headquarters. And one of them is that we offer Cancer Support Helpline. So the number here, if anyone wants to jot that down, it's also available on our website as well. And we're connected with other communities across the nation and even the world. Some of them are called cancer support communities and others go by a Gilda's Club name. My Lifeline is an online program that's available in both English and Spanish. And it allows you to connect with others, find support and hope, exchange ideas. There's discussion boards on this particular application. And then you can also connect with the community either privately, or you can document your blog, your journey through cancer, and help keep others updated what's going on. There's a calendar that you can put in certain tasks where you might be needing assistance or assign a care coordinator to help someone maybe grocery shop or provide childcare or take you to a doctor's appointment. The Cancer Experience Registry I mentioned before, but this is our ongoing online research study that's looking at understanding emotional, physical, practical, and financial impact of cancer and any of the unmet needs that you might be experiencing. It really helps us to gather data and to help direct our programming around the things that for those who fill out the experience registry, we can really target our workshops and classes towards that. This is a little information about our grassroots network. And we are at a place of questions and answers. So I'm going to let you come over into the hot seat. Oh, okay. Okay, so this program is made possible through the charitable grants from Sanofi and Regeneron. Oops, there we go.
I can help moderate if you want to. I can help moderate the chat from all of there. I'll switch places with you, Nancy. So I can help read out.
Thank you so much, Nancy, for reviewing all that information. For those online, if you have any questions, please feel free to put them into the chat. And then for those in person, if you just want to raise your hand, and I'll try to keep in mind who came first. So we do have a question online as people start thinking. Sorry about that. Thank you, Maria. So just to repeat, for those online, if you have any questions, please feel free to put them into the chat or unmute yourself and let me know you have a question to ask. And then for those in person, to please raise their hand and I'll do my best to go in the order that I see. So we do have a question in the chat. I get a fair number of keratoses. My dermatologist burns them off with liquid nitrogen. Should I be concerned? I have Caucasian fair skin and try to run sunscreen on open areas when out.
So keratoses are usually, there's two variants that we see a lot of. There's actinic keratoses, which are considered precancerous spots. About 1% of them can turn into squamous cell carcinoma. So because there is that kind of potential risk that it turns into a skin cancer, we often treat them with freezing. If it's kind of at a point where it's not responding to the freezing, it keeps on coming back, or it's getting kind of bigger, has kind of a bigger root to it, then your dermatologist would probably recommend a biopsy. But you could always ask your dermatologist if if a biopsy is necessary for one, or if the freezing isn't adequate treatment. But we do freeze things quite a bit in dermatology. And then seborrheic keratoses are the more common types of skin cancers. These are not malignant, and you develop more as you get older. They don't need to be frozen, but a lot of people, if there are particular ones that are itchy or bothersome, prefer to have them frozen. And so that's kind of up to the discernment of your doctor if it needs treatment or not.
I see you unmuted yourself. Do you have a question for Dr. Kim? Okay, Tom, I'm gonna mute you. If you have a question later, please unmute yourself. There was a question in the chat. Who do I contact to get help understanding the CSE multicolored brochure? So all the brochures that were mentioned today, I will be emailing either today or tomorrow, as long as I know who you are and have your email address.
But it'll just go over more in detail as to all the resources that Nancy talked about. Thank you. Are there questions here in person?
Yeah.
So I think he had a question.
Oh yeah, go.
It's okay.
Yeah. Okay.
2 weeks later, it didn't look like it's healing. The way I know I didn't, so I went back to my family physician, and she said, I shouldn't be concerned, but if you want to, and that's the part I really like, if you want to. You have to have an understanding that the doctor is at the same level, understanding. So you said, if you want to, I can put in a authorization request for the dermatologist. I said, please. So that authorization for 2 weeks. So we talk about them. In which the part was doing its own history. And I documented taking pictures and because this is the development in the world after the film. When I got the first year to the psychiatrist, dermatologist, it's a big team of 5 to 7 baby daughters are trying to different type of cancer. They have cancer. And guess what? The look and she said, are we became her? And that was exactly what I knew the delay of all that was pretty much making her what factor to satisfy my needs for the future. So
Irene, do you have a question? Make
I
sure that
aligned. Then she said, I can treat it again. And I said, no, I want about. That's where how you said, I get your needs. I knew that at that stage after a month, I need to know for certain. And she said, within 3 days later, she called me that I have an appointment to the surgeon process. So you see how Einstein made a huge difference. So my question is, when she did that surgery with the new doctor, she mentioned that she would have to sew because she had to dig deeper now that she had made a huge. And she promised that the thread she's using is
But let me let Dr. Kim just summarize real quickly because we have people saying that they can't hear. So Dr. Kim, can you just explain that she's advocating for herself?
Yeah, so there's an audience member here who is kind of reviewing her history of a spot that she was concerned about. It took a while for her to get a referral to a dermatologist. The dermatologist saw her and wished that she had come earlier. And so, said, when she saw the dermatologist said, we could freeze it again, but she had requested a biopsy because she knew what she needed for herself.
I can the thread coming out. She had a laughter from the whole team. I didn't laugh because she just always said, absorber, right? And after today, a year later, I have 5 or 7 switches with instead of going into the skin and dissolving, decided to come out of the skin and switching out. But she chose to aggressively, but that's not practice or not dealing with that spot where she has to that. Is that correct?
That's a question about your personal health. I would defer to your dermatologist. So it depends on how it looks and kind of everything else. I don't feel comfortable advising you on kind of your personal healthcare questions.
Thank you so much for sharing and thank you for answering, Dr. Kim. Yes, if we for any questions, if we can keep them more general, I think for Dr. Kim, she won't be able to answer very specific questions, but she will definitely try her best. Are there any other questions either in person or online? Feel free to put it in the chat for those online. Yes, Karina.
Yes, I think there's a couple questions in the chat.
So I did answer those in the chat. So one was asking where she practices, and I put that web link into the chat, Clear Dermatology. And then there was a question about our CSC South Bay May 2024 calendar. She asked if there's any they can call, and I did give our office number, 310-376-3550, to get that May calendar. Is there another question that I?
No, I'm sorry. I didn't have the update. Sorry.
No, thank you so much, Karina. I appreciate it. Are there any other questions online or in person for Dr. Kim in regards to the presentation or just general questions? Yes, Carla.
Oh, go ahead. I'm just gonna ask, what's the website for the cancer registry?
We can send a link.
Yes.
We'll send you a link.
Okay.
So the question was talking about the cancer registry that cancer screening registry that Nancy talked about. So in my email to you, I will include that more information about that resource. Thank you. Yes, go ahead, Carla.
Thank you. Just a general question when looking at sunblock, and thank you for sharing that it's good to apply even when it's not in summer. What are the things to look for in a
Sure.
sunblock that you feel comfortable with?
So the question was about sunblock, what I recommend and what you should be looking for. So sunblock comes in two varieties. There's physical blockers and chemical sunblocks. So the physical blockers are actually mineral particles. I feel like they work better. They're more effective. They contain either zinc oxide or titanium dioxide. So they're actually tiny little mineral particles that block the sun. But because they are mineral particles, they will be a bit more kind of opaque and white. But I tend to prefer those. They're less irritating to your skin. And then there's chemical sunblocks. These are actual chemicals that take about 30 minutes after you apply to really set and become effective. They have longer, more complicated names, things like avobenzone, oxtenate. There's a handful of them. If they don't irritate you, then feel free to wear them. But in general, you should be applying sunscreen that's SPF 30 or greater. If you have really fair skin and you tend to burn all the time, I would up that to 50 SPF or greater. But in general, my best advice is to try to cover up as much as you can when you are going to be out in the sun. So that means wearing a wide brimmed hat, not just a cap that covers the top of your head, but a wide brimmed hat, long sleeve clothes, long pants. And then in the areas that are exposed, try to wear your sunscreen SPF 30 or greater. And then if you're going to be out in prolonged sun, reapply every 1 to 2 hours.
Good question. Is sunscreen and sunblock the same thing?
Is sunscreen and sunblock the same thing? I think so. So use anything with SPF 30 or greater, and then try to get a broad spectrum sunscreen that covers both UVA and UVB rays.
Is there a preferred?
So the question was, when treating precancerous spots on the face, is there a preferred treatment? So there are multiple different treatments available. There's pros and cons to everything. I think it's kind of depends on how severe your sun damage is. If you have a lot of sun damage that you can't locally treat with the freezing, then using some sort of cream or chemotherapy or even the photodynamic therapy that you mentioned with the blue light is a good option. If you have kind of 1 or 2 spots that you can easily get with the freezing, then that's an option too. But that's a discussion that you should discuss with your dermatologist about.
With the PBT, you have to
So the question was, with PDT, which is photodynamic therapy, how often is that required? That's also very patient dependent. So if you have severe damage, there are people that have get that treatment once or twice a year regularly. If you have a really good result after an initial treatment and your skin is pretty clear, you can wait 3-4 years before you need a second session. But again, very person dependent. Mm-hmm. All right.
Let me see, there was one on here. Are there any other questions
In person or online at this time? Feel free to either put them into the chat. Tom mentioned he graduated from University of Wisconsin-Madison. Go Badgers. Yeah. Feel free to put them into the chat, or you can unmute yourself. Do you have a question, Erin? No.
Any last questions?
So as I mentioned previously, all the resources that Nancy talked about, the brochures, I will email them out by end of day tomorrow for everyone who has joined, as long as I do have your email address. And I believe I have everyone's name, so I know who you are.
And then it's on this part. What's your best recommendation?
So the question was, sun damage on the scalp. What's your best recommendation? Try to minimize any future damage by covering up. So try to always wear a hat when you're outdoors. And then if it's focal spots, then kind of the freezing treatment is a good option. If you have a lot more damage, then a topical treatment is a better option. But, you know, we have to kind of treat the person. So if you have a lot of hair, then putting a cream all over your head is not the easiest to do, and the hair gets in the way of effective treatment. So it depends.
Wonderful. Are there any last questions? Art, did you have a question to ask? Okay. Thank you so much, Dr. Kim, for being here with us today, and for everyone for joining.